All right, let's now get into our big discussion in studio. And joining me in studio today is Mohamud Mohamed Ali, the Governor of Marsabit County. Governor, welcome to the program.
Thank you, thank you.
Thank you for finding time to be here with us.
Thank you.
You've been in office for, what, 8 months now?
Correct.
Some would say 250 days, and I'm sure you had 100-day promises.
Yes.
What would you say are some of your biggest accomplishments, briefly?
Thank you, Hungry, for this opportunity. I will say that it was a very exciting moment for these 8 months in office. We've been able to undertake a few major promises that we pledged. First of all, in health sector, I will say that we inherited a health sector which has been in shambles from all aspects. The referral hospital in a state that will not be fit to be called that because of lacking basic requirements in such a hospital. So we rolled up our sleeves and immediately got down to work.
Okay.
And provided some of the missing equipments in the hospital, some of which are still being procured. We made sure in an attempt to provide universal health care to people. We provided 500 insurance covers through NHIF for every ward in the county. That translates to about 10,000 people covered. And we hope to increase this as every financial year unfolds.
Okay.
We made sure that ambulatory services in the county are free in the health sector. And we made sure that the learning in polytechnics in the county, when you come to education, is free. Yes, those are some of the things that I
you're able to put in place.
And the number of other things, of course, which are in the pipeline.
Okay.
Quite a number of things in the health sector, in water, in food security, which we are planning.
And I'll give you a chance to talk about them. When you came into office, you halted all operations for a month for all departments, I believe, apart from health, water, and security. You were saying you wanted to reorganize structures to improve efficiency and also to look at the issue of ghost workers. When you did your audit, did you unearth a certain number of ghost workers? What have you done with them? Just help us understand what happened after that.
Well, we put a task force to do for us that assignment, and the task force report indeed gave us a lot of information, which we are utilizing to ensure that we have prudent management in the county. Of course, it revealed many shortcomings, which being addressed currently.
Can you give us some examples? Like for ghost workers, do you have a certain number? We've had other governors declaring 5,000, 1,000. What would you say was the case in Marsabit?
Well, we did not get as much as you can say this number of ghost workers and this kind of thing. But ours was, the assignment we did was centered on human resource and financial management generally. Okay. And for the human resource, how these officers are positioned in certain places.
Yes.
What are their composition in terms of representation in the regional balancing? You know, Marsabit has got 14 different communities. How are these resources shared? Because human resources are resource in that strict sense. And again, whether they have been properly put in place. Those are the kind of assignments we were doing. And in terms of financial management, what transpired before us, so that for us to take over, we know where we begin.
Okay.
That is what the task force report was able to.
Did it? So and again, I just want to ask this briefly. Did it unearth two things? Number one, were there any corruption concerns?
Yes.
Yes, there were.
Yeah.
Have they been handed over to the EACC, or how are you following up on them?
Yes, following that, we wrote to the Auditor General to be able to further take up from there.
Okay.
We also wrote to the EACC to be able to consume the report that was generated by the task force, so that they can take it up from there. You know, we are delimited ourselves
in terms of investigation.
In terms of investigation.
And so you say ghost workers not a concern?
It is to some extent. We've been able to establish a number of cases, And that investigation is still going on because people giving you some letters, some of them that don't look really real. People coming up with all sorts of things, you know. So this is an ongoing assignment which we've not completed as yet.
Okay,
yeah.
But you can promise residents that it will be completed soon.
Of course, yes. Some of them, like the works, for example, which were documented that they were done, and some of them we have been able to see they are actually not undertaken. That has been concluded 2 weeks ago, where we are able to separate what is genuine service that has been delivered, what is not genuine, so that we are able to pay those who have supplied us genuine services from those who are not genuine. Equally, in terms of the workforce, this one is an assignment which we had hoped will be completed, but by May, hopefully, we'll be able to conclude that.
By next month, okay, we'll hold you to that. Let's talk about drought now. In early February, the National Drought Management Authority issued a warning that Marsabit County will experience an extended drought period for the next 3 months. What's the situation right now? Have the long rains arrived in your county?
Yeah, at the moment we've gotten a lot of rain, and we thank God for that. We have experienced a dry spell earlier, which was very severe. We had to mobilize resources to look for food for the citizens. We also got some support from the national government, and we thank them. So through that, our people were able to get food for that period. But for now, we are blessed with a lot of rain across the county indeed.
Are you able to harvest that rain?
I will say we are instituting measures to harvest, but for now, we are not yet ready. Far from it for now.
Okay.
But my plan is such that by the time we complete this 5-year period, we will be able to harvest water from the surface runoff, which goes to waste as at now.
Yes.
In fact, it's causing destruction. So going forward, that is in my plan, such that we will not be just relying on boreholes and this kind of thing, but we will harvest water from surface runoff. We will create dams so that this will be able to be utilized for sustenance, for irrigation, so that we'll be able to get food security. Before
you sat on that seat, Devolution CS Eugene Wamalwa was here. He gave assurances that the Balasa Dam is on track. As the governor of that county, can you confirm that this dam, which has stalled for almost 10 years, is on track? Can you really promise your residents?
The story of Balasa is very sad, because we expected it to be already supplying water to the citizens. But you recall during the campaigns also, His Excellency the President himself pledged that he will provide funds to ensure that dam is reactivated and that it will provide water.
2 billion Kenya shillings, I believe. Yes.
So I have been in conversation with the relevant authorities. I met also the President on the same. He has directed that funding be provided. Only 2 days ago, with the leadership of Marsabit County, we met with the water CS, the current, and he assured that he was going to look for funds so that...
so the money has not yet...
Not yet. But
is there a contractor? Because I know the previous contractor had to be paid first.
He has been paid. That court issue has been settled. So there will be no any issue of legal tussle anymore. But the issue is the funding now.
The issue is the funding.
Which the CS said he will implement the directive of the President to ensure that it will be provided sometime.
So realistically, let's look at timelines, because CS Wamalwa, who previously was in that seat, said by 2019, Balasa Dam will be ready. Can we honestly say that now?
From the conversation that we had, because there is another group which is helping us fund water at what we call Bakuli Dam, where currently Marsabit people get water from, which is not enough. So ADB came in, the government sourced that support, and we were discussing with the water CS that we will utilize that funding so that we reactivate Balasa Dam first, because the output from Balasa Dam is going to be more than the output from Bakuli.
Okay.
So we are in discussion, and I think from the initial indications by the technical people from water department. Once that project is awarded, which the CS told us he will do it within the next 1 month, then it will take about, say, 8 months to be complete.
Just 8 months to be complete?
Yeah, because substantial work had already been done, over 75%.
So a 2019 cutoff for launch is possible?
Yes, God willing.
Okay. Yeah. Let's talk about one of your pet projects, healthcare. In December, you announced that at least 10,000 families will benefit from NHIF cover paid for by the county government. In terms of the status of that, you say that has already happened. I heard that in your, in your opening statement.
Yes.
How do you decide which family gets the cover?
We have multi-approach, and I mean, we put on board all the leadership of the county, from the senators, the MPs, the county reps, that is the MCAs, local leadership, the chiefs, the ward administrators, so that we determine from every ward the elderly and who are also poor and the disabled. That is discussion at that local level, whereby they identify in every ward, this is the group, the 500, who they think from their assessment are the most needy, and that is how the county will provide that.
How do you keep a process like that clean from clanism, tribalism, politics?
Yeah, because
measures have you put in place?
Yes, I'm sure, yes, what you are saying is very genuine, because we as a country, we really value our clans as such, but the team, as I told you, headed by the ward administrators at the ward level, and the leadership cross-checking what they do. I think, although I can't say with the confidence that that is eliminated 100%, but I think it has that confidence level that it is not subject to misuse as such, and that only the needy will be able to get that service. To get that service,
yeah. Okay. So fair enough, people now have a cover. They can go to medical facilities and at least know the burden or the cost will be shared, you know, because of the other particular cover.
Yes.
But I have received reports that there are still some challenges in the area of healthcare. For example, shortage of lab technicians, shortage of medicines in a vast county like yours. And I've even heard that there has been a lack of, or a challenge getting surgeons there, gynecologists in your county as well. So you have the cover, but you don't have the specialists who can go and handle this as well.
Correct.
So are you really able to help people in terms of healthcare with those challenges?
Yeah, I think you can't be any more correct. Those are all real problems that we inherited, and since then we've been able to work around the clock to ensure that that burden is managed, is reduced, if not completely eliminated. For example, we've been able to get, as you said, we didn't have a gynecologist. Today we have a gynecologist.
Today you have one gynecologist?
One gynecologist in my county since I came, and is providing wonderful service to the citizens. Equally, you recall very recently, I accompanied His Excellency the President to Cuba, where we discussed health matters. And we managed to bring back some doctors to the country, where every county will be able to have. And through that, we've managed to secure 2 specialist doctors for Marsabit County. And we are still going on. There is a process which hopefully hope to conclude in the next 3 weeks, where I will be able to get probably some more specialists.
What are the challenges you're facing? We hear that at some point the previous regime had even given some very good terms for doctors. Come to our county, we'll pay you this much, we'll give you a house, we'll give you all these, but they simply declined to come over. Talk to us about those challenges. Yeah,
I think they declined because of the environment. They had some issues here and there. I don't want to go into the details, which we've been able to get over. The working environment today is very conducive, and the doctors, a few I talked to, some of them are saying they are going to talk even with the organizations to see how they can be able to influence some of them to come. And we have said we have to give that healthy working relationship between us and our professional people who give us professional services. That is behind us now. The other problem is the problem of equipments. They are lacking, most of them, which we have taken stock of, and we are supplying the critical ones which we afford. It's the issue of affordability. Others might have to wait the next financial year. Some are being procured as at now. The other challenge is the dispensaries, the health centers, maternities across the county are all under-equipped and understaffed. That is a major challenge, which I can't say I am sorting out right now, but I have put measures in place going forward. Those health centers will be properly equipped and will be getting staff. With
all the challenges you're sharing with us, is the 7 billion that your county has been allocated sufficient?
Not at all.
Not at all?
Not at all. But we are making efforts to ensure that we get different sources of funding through partnerships, making proposals to donors. And I'm grateful to quite a number of partners. They are coming in handy. For example, in terms of water and food security support, KFW has given us a grant of about 800 million so that we are able to leverage our people in provision of water services and food security. This is an ongoing partnership, and plus many others.
Governor, one factor that has strained your county's resources is that of refugees. We know that Ethiopian refugees have been streaming into your country for the better part of this year. Some conservative estimates put them at anywhere between 5,000 to 10,000. Do you have figures as of today, and what is the plan to deal with them and to assist them at the same time?
Through my friend, we had over 11,000 refugees at the beginning, about from last month up to date. And fortunately, after I think Ethiopia got in new leadership, most of those people have gone back.
Also, they've gone back.
So Marre camp has been closed. There is a camp at Dambalafachana, which is in the process of winding up, and the number has reduced to less than 3,000 now, some of whom might be wanting to proceed to other areas. But so to speak, initially it was a major challenge. The county was not properly prepared to receive this group, but we mobilized all the resources that we could, and that we managed it, and we thank all other partners and the national government for the cooperation we had. Now it has been sorted, I will say, to a great extent. Only a few are left now.
Only a few are left now. And finally, in your speech after the High Court ruled in your favor, in a petition brought to you by a CSE attorney, you stated that you did have reservations about the decision by the president to appoint the ambassador as a CS. What were those reservations?
I don't want to talk about the reservations I had now, because it is now behind us. Yes, you know, he was my competitor, and of course, you know, when these competitions happen, you know what to expect. And I understand this man too well, and I have stated those reservations, and we did a press conference. But when His Excellency the President went ahead and appointed, that matter put that case to rest with finality.
So you're not leaving.
I don't want to petition the decision by His Excellency the President. I support him in all aspects, his undertakings. So I hope we will manage him at the national level so that he doesn't cause us problems in the council. And I wish him well.
And you wish him well?
Yeah.
Okay, very interesting choice of words you've used there. Governor, finally, in the last 1 minute, I just want to hear from you. Concerns by your constituents about the reshuffling you've done at the county level of your officials, putting of officials with different qualifications in dockets that ideally should be by other people as well. There are concerns that a bit of clanism is coming into your administration. How would you respond to those who have those concerns?
Very good question, and I will like everybody to listen to this, because it's unfortunate. My friend, when you appoint somebody to an office, that officer, it is not his choice to choose where to work. Where you are appointed, you deliver that service. What happened in the last 1 week is that to improve services, some people we inherited, they have stayed in one station for too long. For one reason or the other, we did some reshuffling. Unfortunately, because of misconception, some people went to their clans. You know, this is very sad state of affairs. We cannot have this. A government is a government, whether it is a county government or whether it is a national government. Have you had any complaint from any clan that somebody has been transferred from national government? This is tragic. So going forward, we are not succumbing to this kind of thing because we are in service delivery mode. We are not in electioneering mode. We are not going to appease people by saying, oh, so-and-so must be in that docket, so-and-so must be in this department. That one I will not listen. It doesn't matter what pressure.
How crucial, and I'm looking for the right word, it's just that it's not coming to me at the moment, clan politics, clan influence on governance. In this day and age, how necessary really is it?
It's very sad. It's unfortunate. It's not necessary, but it happens in our country. It happens, and especially so even in my own county. People run to their clans for this kind of thing, and even during elections, people vote in clan blocks.
Guided by the clan.
Yeah, this we must shed. Going forward, people must choose leaders based on their quality of leadership, not on basis of where they come from.
You're not afraid that those who lead clans are watching you now and thinking this will deal with?
No. We have to tell our people the truth, and I have been consistent on this. And this affected us even in 2013. We've been able to manage to put the whole county together. We are in office across the board. We didn't say clan A, clan B gets this and that. Although we were careful in balancing. And when we balance and appoint people from various geographical regions and even various clans, it does not mean that when they come into the county, they will say this is a reserve for clan A and this is a reserve for clan B.
Okay.
No, that government doesn't work that way.
Governor, thank you. Thank you so much for finding time to be here with us today on Citizen Extra. That's Mohamud Mohamed Ali, the governor of Marsabit County, just sharing his thoughts on what is happening in the county.